Hello, everyone. This is Ramin, and we're going to be talking about lack of healthcare in sports. And this project is done by Kate, Matthew, and I. So we're going to be talking about the background information first. Even though healthcare has been around for a long time and has been somewhat effective, there are still flaws. The issue in healthcare in sports is mental health because it is very difficult to identify, and many athletes are affected by it. According to Donovan Martin, 30% of the elite athletes are going through a mental health crisis. Sometimes the psychological response to an injury can be devastating and it is usually not taken into account. Injuries like concussions are very common and it is very difficult to know the psychological responses to the injuries. It is common for athletes to be afraid to be honest about their symptoms and they feel that counseling means they are weak, so they are less motivated to do counseling. Physicians and trainers do not always understand the signs and symptoms of the athlete's problems. Up next is who and what does it impact. These issues that are hard to be aware of impact the athletes, their families, the team, and can even change the way someone sees the sports industry. The issue can be from many factors such as the trainer, physician, the surroundings, personal feelings, loneliness, or neglect. Sometimes there are cases in which the injury is not that bad and the recovery is quick, but for others the situation can be different and nobody might know until it is too late. It impacts the athletes on an emotional and mental level in which they will feel like they are not worth anything or that their situation will never get better. When someone enters into this kind of negative mindset, it affects their decision-making skills and the amount of time it takes for them to heal. How long has this been an issue? Healthcare in sports has been around for as long as sports have been around. A good idea of the measurement of the length of time it has been an issue is the amount of people who are in sports who suffered a mental crisis each year. There have always been times where athletes got injured and they could never get back into being the athlete they wanted to be. As long as we have a problem understanding and identifying people who are suffering from this issue, it is more likely that it will not stop unless we find a way to identify and stop it as soon as possible. Why is it an issue? Depression, anxiety, disordered eating, and substance abuse or abuse are just a few things that a response to injury for an athlete may trigger. The medical information itself can cause emotional problems such as sadness, isolation, irritation, lack of motivation, anger, frustration, changes in appetite, sleep, disturbance, and disengagement. Depression magnifies other responses and can impact recovery. Injuries like the knee injury can stop the athlete from playing the sport they love, which both emotionally and physically affects them as well as decreases their quality of life. Injury can lead to depression, and depression can lead to thoughts and ideas about suicide. These issues exist because mental health is not taken seriously, it is not identified well, and usually nothing is done.
So, how sports can solve this issue? Athletes in the four major sports leagues, which would be the MLB, NFL, NBA, and NHL, all need to come together and bring light back to the issues of healthcare in sports. Many professional teams have very, very good healthcare programs, and some sports teams don't have so good health programs. So there is room for improvement, and the room for improvement comes from things that we don't really know about because modern day professional sports have only been around for 100 to 120 years. Each and every year, more things arise that we learn. Athletes are learning about their bodies each and every year. Doctors are discovering new medication each and every year. And new concepts like injury prevention can come up, where injury prevention is when athletes take precautions and measures before, during, and after games so that their bodies can heal and maybe not get injured. And another important issue is mental health. The talk of mental health has been a very, very important thing over the last few years. And these athletes can deal with mental health issues that the normal public eye may not see. If professional athletes are adamant about their mental health, it could potentially inspire the youth to be adamant about their mental health, which would continue to raise the light shine on mental health, which would be very beneficial. Who is involved? All the athletes that play sports are involved. All the personnel involved with sports are involved. Um, Healthcare issues should be solved by a group of people, not just the one athlete dealing with that issue. The more people that are aware of the injury, the better. More professional opinions on rehab and recovery, the faster the rehab and recovery can be. That's why you see when an athlete gets injured, they have multiple opinions on the injury from multiple different doctors. As athletes deal with injuries, professionals can review those injuries and research new ways to prevent the injuries and other potential recovery options and new types of medicine and new types of therapy and things like that. This issue even extends out to people who don't even play sports. For example, if a child is playing a sport and gets hurt or has an issue with his mental health, that child's parents would be affected because they would then have to take the child to the doctor or help the child recover at home and things like that. There's many steps to solve this issue. Our plan is just to continue the advanced research on sports medicine because there's still plenty to learn. We also think teams should implement a mandatory mental health check more often. We believe this will improve the quality of life for those affected by mental health issues because the players will be able to receive the help they need but might not know how to address the issue. We run into that a lot. People deal with these issues but they don't know what to do, and they really don't want to reach out because then it'll hurt their public image. So there needs to be a way that athletes can anonymously receive help from different outside sources and things like that. We also want to make medical checkups a more regular thing. It's never a bad idea to have a doctor look over you because there could be things going on that you're not too sure of because sometimes the symptoms don't arise until it's too late to fix that issue. Like, for example, recently, NBA player Karis LeVert was traded from the Brooklyn Nets to the Indiana Pacers, and he had a physical with the Pacers, and the Pacers team doctors found a tumor inside of him. That tumor probably wouldn't have been found if he didn't get traded, and that's not good. So we think it's important that players take 15, 20 minutes out of their day every now and then just to go get looked at. It's not going to hurt you. If anything, it'll be super, super beneficial to what you're trying to do and just look over your body and it's very beneficial.
For the strength, weakness, opportunities, and threats analysis, or the SWOT, for strengths, overall, the strength of our solution for increased mental health care and healthcare awareness is the flexible and accommodating portion of it. We want athletes have busy lives, and we want to make something that can fit to their schedule, or that they can do 5 minutes in between practice, but while also maintaining a consistent healthcare service. Now, our weaknesses, as mentioned earlier, athletes have this mental block that they hit when they get hurt. They either don't want to address it because of a chance of it impacting their career, and many healthcare fields actually have this dilemma, but getting honest answers from patients and having them address problems is one of the biggest weaknesses of our solution. Now, with this solution, there are also many opportunities. There's an increased potential in the world of mental health as well as the full body of mental health, full body health. If sports use their platform to address mental health in athletes and adhere to our advice, people will stop treating it like such a hush-hush topic. The more you see something, the more familiar you are with it. So if little boys and girls see their athlete idols addressing their own personal mental battles, then they'll be more inclined to do it. So this will have a chain reaction and go through many different people and portions of the population. Now, since society breeds perfection, one of the threats is that mental health is relatively a new conversation. There could be pushback from teams. Addressing issues could mask an athlete as damaged goods, lowering his or her signability. However, hopefully requiring certain testing to be mandated will overshadow the stereotype because everyone will be doing it. Sometimes you can lead a horse to water, but you can't make him drink, meaning that we need full cooperation in order to make an impact. So if everyone's not on board, then we will have a problem. Now, success will be measured in 3 different ways. Number 1, we'll see a decrease in CTE. As time goes on, regular brain monitoring is mandated, as well as other brain monitoring technology is created. Hopefully, we'll see a decrease in athletes' diagnosis with the diseases such as CTE. CTE is a chronic traumatic encephalopathy. It's a progressive and fatal brain disease associated with repeated traumatic brain injuries, such as colliding of heads and concussion. This is frequent in football and things like soccer, things like that. With consistent monitoring and regular checkups and scans, we can better treat head injuries in sports and then keep our athletes from pain later in life. Now, the second measure of success with our plan is a decrease in athlete suicide rate. Thoughts of suicide run deep under mental duress. A lot of people who are struggling mentally will also have thoughts of suicide. As an athlete, sometimes the weight of the world can be too heavy. There's a lot of eyes on you, and the pressure that one off day can ruin your entire career is a lot to handle. Now, being able to check in and give immediate and anonymous help to those who are struggling is going to be really vital. Maybe some people just want to unload and talk, but this will also decrease the number of suicides amongst athletes overall. A lot of people who just need someone to talk to, we just need to remember that athletes are people too, and they just want to be heard, so this is crucial. At the end of the day, the less stress someone is dealing with, the better they play, and that's what we all want at the end of the day. Now, the third measure of success is increased familiarity with mental health. The more you know, the more you grow. Now, when we take an organization big as sports and they take on this task of mental health and they brand themselves with it, the chain reaction does occur. People can't care about what they don't know. So making them aware of this problem and of this kind of lifestyle is definitely important. Now, targeting areas of mental health in the world of sports, then the fans will take on to that and spectators will follow in line with the movement. And then as well as just making, as soon as the topic of mental health isn't as hush-hush, the shameful, then real work and success can be measured later on. Now, it can be implemented today. Certain mandates and mental health checkups / testing and scans can't happen immediately. However, the conversation starts now, and that's half of the healing. If we introduce the mental health care platform to sports organizations today, people will begin to familiarize themselves with the idea of mental healing. Having open conversations with their friends and families as well having them mentioned on team-related medias would help and bring a massive upward and commotion to brain health and maintaining a good headspace. It's okay to be not okay, but it's not okay to sit around and do nothing about it. So the biggest thing we can do today is just deciding to join the mental health team. Thank you.